Welcome back to Isaacs Dentistry. Welcome back into our office. We're here with Dr. John Isaacs Jr. And last time you were with us, we kind of walked you through the office, what to expect from the time you walk through the front door to when we bring you into the back to actually do work or to evaluate you. What I thought we'd do today is we'd talk to the doctor about your first visit or your first visit back after several years of being out of the dentist, and that first eval and why it's important and the tools we use and why we do what we do in order to get a full evaluation of the problem at hand or a potential problem at hand, and why the doctor may order certain x-rays or procedures in order to help diagnose and get you on the path to recovery or to a cosmetic fix that may be necessary. So Doc, when someone comes in the office, we bring them into the back. Myself, Mary Beth, one of the other assistants, we do a general question with the folks. We'll ask if something's hurting or the generals. But when it comes to that eval of the patient, we've got several tools that we use, one of which is a Panorex x-ray or a full mouth x-ray.
Well, let's stop back just a little bit. The first thing we always do, of course, the very first thing the patient's going to do, they're going to come in and we're going to have them fill out a form. And on that form is a health history, very important. So we've got to know what kind of medications you're taking. It's a cursory a medical exam that we're doing in there. We're just trying to hit the high spots to make sure that you're okay and able to have a preliminary treatment done. And there'll be several questions that we ask. We'll go over that in a second.
Right, and that's important, and I was going to get to that in a little bit because there are certain questions on there that are very important depending on what procedures we're going to be doing that dictate whether we can do them and how we need to do them. Sure. But so as we get them in the room and we go through those questions, we've read through their form, we've got different x-rays that we'll take for diagnosis purposes or consultation purposes. Sure. So start with a Panorex. What are you looking for when you order a Panorex x-ray?
Panorex is probably the most important x-ray that we take. It goes from ear to ear. It shows a wide range of the image so that you can make a diagnosis. We don't diagnose from the x-rays, but it's certainly it's an invaluable tool that we use. And we can see from that, we can see from condyle, which is the ramus of the condyle, which is part of the mandible, the jawbone, all the way to the left to right, and all the teeth in between. And it gives us a good view. What I tell people, it's sort of like a Panorex is sort of like walking into a room, squinting. You can squint so you can see everything in the room. You can't see it clearly, but you can see that chair, you can see the television, see a picture, and if you can just see what it is. Now, the other x-rays that you talked about, the periapical x-rays, the smaller x-rays, that shows a lot of detail. So we want to see something after we look at the Panorex and zero in on something, then we can take a smaller x-ray with the periapical x-ray, and I tell people that's kind of like that same room you have. Now you're looking through a keyhole. You're looking through the keyhole. Now you can see the image very clearly. You can't see what's around it, but if you know, you can actually see who's over in that keyhole, and you can see what they're wearing. You can see everything. You can see if they have glasses on. So it's a little more definition.
Right, and that's a great point. Is we will start with that broad look of a Panorex, and then once we go that, we move into a lot of times a PA or a periapical x-ray to pinpoint something you picked out on the Panorex. But another one of those diagnostic tools that we'll use, and a lot of times if you come for a cleaning with one of our hygienists, they'll take these. They're called bite wings. But a lot of times they'll come see us first before they see one of the hygienists. And we'll get some bite wings on them. And what's the diagnosis tool with bite wings, and why is that important to that initial visit?
Yeah, not all x-rays are the same. Of course, we're using essentially the same amount of radiation, which is extremely low, and I'll go over that in a second too. But the bite wings, it is shooting the x-ray in between the teeth. So we're looking in between because we have cheeks there, we can't see the angle, so what the x-ray does, it shoots the beam right through it, and we can tell if you have cavities between your teeth, which we can see it. If we look on the top, we can see the side, but you can't see in between, which is where probably I'd say 75% of the cavities are. If you miss them and you don't pick it up the next 6 months or the next year that we see you, it'll be out of control, and we'll probably either have to do a root canal or get the tooth out.
Right, and you were talking about Panorexes are so important to diagnosis as well as the bite wings. And that's why when you come in for that initial, we most likely will get a Panorex, we will get bite wings, and then if the doctor notices something we really need to pinpoint, we'll do that other PA or periapical x-ray to really pinpoint that specific tooth. But as you continue coming in for your cleanings and other procedures with us, every 6 months to a year, we will update bite wings or even the Panorex because we need to adjust from year to year.
Sometimes
right?
now we only take the bite wings sometimes no more than once a year, sometimes every 2 years. Really depends on the patient. Some people opt out of it, and we're fine with that. We tell you what we think, and if we see something, then we'll do it. Well, we try to find out what's your reason for it. We'll try to put you at ease with the radiation, which is negligible. Also, the Panorex. If you're a patient of record and you've been seeing us for a while, I usually kind of give you the Panorex. The reason why I do that, I just don't want to miss something.
Right.
I feel better. I sleep better at night knowing that I've done my best and not let the fact that an X-ray stop me from doing what I needed to be doing. So that's what happens.
Now, these X-rays are very important parts of that initial visit and that consult with you and trying to figure out what the problem is. But I think an equally or if not more important part of that initial visit and that initial eval would be the oral evaluation, the actual physical evaluation with you at chairside. Can you explain, when you do that initial consult with someone, what are you looking for? What are the some of the markers or some of the indicators you might be looking for when you're looking through someone's mouth? And
when the patient comes in and they see me first, besides the hygienist, they usually have something. They're usually either in pain or they have some acute problem. So I will look inside there and I will do an oral exam. What am I looking for? First, I want to evaluate their chief complaint. If they have a toothache, we want to make sure, yeah, that's the one, or we'll figure out where it is. And then throughout that, I will look at everything in there just to make sure that there's some underlying reason, something's going on, and we'll try to treat that on a subsequent appointment. We certainly, every patient that comes down, we look at all the soft tissue. We'll look maxillary, mandibular. We'll look at the hard tissue, the soft palate also. We'll look at the tongue. We'll look under the tongue, and we'll look at the back of the throat. And you notice I always stop. The last thing I do is I will look at the back of the throat. We'll look down as far as we can to get the patient to say and just look down there to make sure we're not missing anything. People I used to stay away from the C word, the cancer word, but people want to know, hey, is there something wrong with me? So now we don't shy away from it. Heck, we want to make sure you don't have cancer, and that's what we're looking at. And if we think there is a problem, then we'll certainly refer you to the oral surgeon or to an ENT for further evaluation. So, and if you think there's something wrong and you just want me to take a quick peek, heck, I'll look at you for nothing just to make sure that you're not shying away from it.
Right. Since we're talking about those first visits or the return visits after multiple years without seeing a dentist, what is a good age? Because we hear this sometimes. You know, my son's 5 years old. When's the first time I should bring him in? Or my son's 3. Should I bring him in to have you check him out? So, on the young end, what would you say to our folks out there?
Well, the answer is the sooner the better. However, the pediatricians and the MDs in this area are excellent, and they all look in the mouth, and they're all given a good exam upon birth. So every time a kid goes to the doctor's looking in their mouth too. So it's rare that we need to see them before age 4.
Okay.
Now, if you and why do we say 4? Because before 4, they're not going to cooperate. We did see a little kid yesterday that was 2 years old, fell, hit the toilet and broke a tooth out. So we do see, if we have to, but just for an exam, we don't really need to see them until age 4, unless the parents have a specific problem. Because you really can't get them in there. But even if you want to bring your 2-year-old into the chair, heck, we'll give them a chair ride. Because it's kind of fun. We push the button, let them push the button, they get a little prize and they feel good about themselves. So bring them in for the first exam at 4, but certainly before that we'd like to give them chair rides.
Right. And so that's first exam. What about on the hygiene side? What about when do you suggest for the kids to come in and get their first cleaning to get on that schedule?
If they can cooperate, 4 years old.
Okay.
Now if they can't, then we just kind of play with them and let them progress at their level. X-rays, we don't take X-rays on kids until probably 6, 7, 8, sometimes 10, depends on what they need. If we see a need, certainly we will on a 4-year-old, but we generally don't because we can see what's in there. Teeth, the primary teeth are little translucent. You can almost see the cavities in there instead of having to see the X-rays, and you can just kind of manipulate around there. So we really don't take them until preteen.
Right. And one of the good things about that too is if you do have a child who's somewhat cooperative and getting them in at that young age, it helps eliminate that fear of the dentist's office, and it helps kind of build that routine of good oral health and keeping up with those appointments, whether it be cleanings or just checkups with the dentist. So that's a very important thing because we see a breakdown in that a little bit now with society. So.
Yeah, let me just kind of say, don't get me wrong, there are many dentists who will do X-rays at an earlier stage. I know the pedodontist will. It's just my personal experience that I don't really need it until I see it. And if I do, and the patient's not very cooperative, sometimes we will refer to the specialist, have them sedated, but we just don't see a real need for that right now.
Now, real quick before we wrap up, I want to go to the other extreme. That's what age should I start to bring them? What about the folks out there that have an older parent or themselves are older and they don't have teeth anymore, but they sit and go, well, I don't need to go to the dentist, I don't have teeth.
Well, they're right. They don't have teeth. Even if they have a denture, an ill-fitting denture can cause problems. You can get some tissue hypertrophy. The gum will expand and cause problems. We see that quite often. Is it pathological? Strictly speaking, yes, but it harbors bacteria, but it's really not a big concern. It's only a concern if the dentures don't fit because of it. Now, we would like to look in there. We would like to look periodically, at least once a year, just to make sure there's no growths in there, nothing we need to treat. It's always easier to treat it sooner rather than later. If the patient sees something and they're looking at me to look at it, it may be, we wish we saw it before the patient knows it's there. That's what you want to do. Cancer does not hurt. There's no pain involved until it's too late. Once you come in and say, man, this thing's really killing me back here, there's something wrong, we wish we saw it probably a year ago. So we will do an exam on that. There are ways of, there's other biopsies you can do, but generally speaking, I don't even do that anymore. I'll go ahead and send it to a surgeon. We will keep a specimen at some point, but it's rare that we actually have to send it off.
Right, and that's why I brought it up, because we do have several here in office that we do see on a yearly basis, just to kind of check, even though they haven't had teeth for years and years. And I think it's important for folks out there to also realize that even though you don't have teeth, that doesn't mean you shouldn't come in and be evaluated by a dentist, like the doctor said, about once a year, because there's other things that can happen.
Let's go back to the carcinoma, the oral cancer. It's usually smoking is very prevalent here in Kentucky, as we all know. I think we're #1 as far as the number of smokers and people starting at an early age. I believe I heard that a week or two ago. We're #1. We're also #1 in the per capita of people that have dentures.
Right.
Now, West Virginia has more people that are toothless, edentulous, but we have more people that are dentureless with dentures.
Right.
So we have that up on West Virginia. But because of the high prevalence of smoking and drinking, carcinoma, the cancer is generally in combination with smoking and drinking. So if you have a concern, heck, just come in sometime and I'll take a peek at you. It won't take me 3 minutes to look down and make sure that everything's okay if you have a concern.
Right. And kind of going off of what we've been talking about, your first visit or eval with us or one after many years, I can tell you that we've seen a few folks here who came in that had no teeth, just had dentures, and it was the first time they'd walked into a dentist office in about 20 years. So it's never too late to get in here, get a check. It's always peace of mind, something that'll help you out. Doc, before we go, is there anything else you want to touch on with those first visits or getting in?
That was a good point you just made about the dentures. A lot of times we won't see the denture patient. They forgot all about the dentist because they've got their dentures until they drop it and break it, and that's when we see them again.
Right.
So then we're doing a repair and say we'll bring them back and take a quick peek down their
Right, but you still want to come in, like Doc was saying, at least once a year. Let us do a quick once over, make sure nothing's going on, make sure no bacteria is getting growing or anything going on in there. So thanks for joining us again here at Isaac's Dentistry. Hopefully get a little insight into what that first visit will be like and why we do what we do on those first visits, and how important they are to the doc figuring out what he needs to do and coming up with a treatment plan for you. Thanks again, and we'll see you next time right here at Isaac's Dentistry.